Hi there, my name is Dominique from Well Medical Arts, and I'm going to teach about Botox today. There are actually 3 different kinds of botulinum toxin type A. The first one we all know is a brand name, Botox. Second one that came out was Dysport, and the newest is called Xeomin. It's Xeomin. Now all 3 of them are just slightly different versions of the botulinum toxin type A. They're a class of medicines called the neurotoxins, because the way that they work is they intoxicate your nerves, just temporarily, so that nerve can't make a proper conduction to the muscle, then the muscle can't make the contraction that causes a wrinkle. So it's a muscle relaxant. There's Botox Cosmetic and there's Botox Therapeutic. They're actually the exact same medication, but we'll reconstitute them differently according to what we're going to do. With the Botox Therapeutic, I treat migraines. There's a migraine protocol that goes all over the head. I treat a condition called bruxism. Those are the people who are clenchers and grinders, and it may be causing teeth or TMJ problems. And I treat a condition called hyperhidrosis. That is for the excessive sweating. So we can do under the pits, the hands, the soles of the feet. Botox works great for those conditions. For the Botox Cosmetic, remember, it's a muscle relaxant. When we relax a depressor, it lifts. So think of Botox not only as getting rid of wrinkles, but also as a facial lifter. I want to show you all the things that I can do with the Botox so you'll know the many applications. First off, it is indicated for only 2 areas of the face, and that is the corrugators and the ocularis. So these corrugators are to treat the lines right in between the brows, we lovingly call the 11s. By putting it into the corrugators, which are depressors, when it relaxes, it lifts, and then these wrinkles fall out. We can also do the horizontal lines on the forehead. There are a few different kinds of brow lifts. We can do right above the pupil and at the lateral brow, the ocularis around the eyes for the crow's feet, the nasalis for what we call the bunny lines in women or the wolf lines in men, the procerus for the lines that go across the bridge of the nose, and we can actually do a lot of lower face lifting with the Botox. Even the nose. I can do the tip of the nose to lift back this way, the base of the nose to lift up this way. If someone has a gummy smile and they're self-conscious of it, I can do a little bit of Botox mid-lip to drop the upper lip down to cover up the gums. Any of these little fine lines around the mouth, just put 1 unit in each little line. Can't use too much around the mouth, but a little bit is very nice. As the corners of the mouth turn down. Now this muscle right here is called the angularis. It's the strongest depressor in the lower face, and it pulls down and makes this little pre-jowl and the marionette lines. So we'll put a few units at the corners of the mouth so that the corners of the mouth turn up and look a little more pleasant, or a few units down into the body, the base of the angularis, to help get rid of that pre-jowl. Great point. The muscle that actually causes a lot of the jowling is called the platysmal sheath. It's a superficial muscle that goes over the top and wants to pull down. So we'll boop, 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 and that one lifts up this way. Sometimes people have a little unhappy line in their chin. A little bit of Botox into the line softens it. Some people have a little bit of pebbling or dimpling in the chin. A little bit of Botox smooths that out so it's not pulling. And lastly, I can do the neck. There are 3 different ways to do the neck. There is the central band. We'll do a little triangle shape right through here to lift up. There are the 2 platysmal bands. We grab the bands, Botox the insertion point and down the band, and that pulls back this way, another nice point. And then there are the rings. When we do a normal Botox treatment, it's intramuscular, so right into the muscle. When we go in to do the rings, it's right underneath the surface of the skin, intradermal, and that helps soften the rings. There are lots of applications of Botox that makes women really excited, and I say one woman should not have it all. What I like to do is evaluate their face and figure out what I call their money points. How much wear to get the best placement, the most cost-effective placement for them. I invite you to come in and schedule an appointment. I'd love to do you.